Did you know that over 80% of men over 60 will experience prostate enlargement, yet most are unknowingly accelerating this process through daily habits they consider harmless? I'm Dr. Elena Carter, a physician with over 10 years of experience specializing in health and quality of life for people over 50, and today I'm going to reveal the 10 most dangerous habits that are silently damaging your prostate right now. You'll discover why drinking certain beverages at specific times can triple your nighttime bathroom visits. Learn about a common seating mistake that restricts blood flow to your prostate, and understand how stress hormones create a perfect storm for prostate inflammation. I'll also explain the surprising connection between belly fat and prostate growth, plus share a simple hydration technique that most doctors never mention, but can dramatically improve your symptoms within weeks. If you've been waking up multiple times during the night to urinate, struggling to start or stop your urine stream, or feeling like your bladder never completely empties, these are clear warning signs that your prostate may be enlarging beyond normal aging. What many men don't realize is that certain everyday behaviors are accelerating this process far more than genetics or age alone. As a physician, I've treated hundreds of men who arrived at my office in desperation, some even requiring emergency catheterization for urinary retention, simply because they ignored these warning signs for years. However, I've also witnessed men in their 80s living completely free of prostate symptoms, precisely because they modified these critical habits before permanent damage occurred. The difference between men who suffer and those who maintain healthy prostate function lies in understanding these seemingly innocent daily choices. Today, we're going to examine the 10 most harmful habits for your prostate health, starting with the most overlooked yet dangerous behaviors that could be setting you up for years of discomfort, sleepless nights, and expensive medical interventions. By the end of this video, you'll have a complete action plan to protect and even improve your prostate health naturally. Let's begin with our countdown of the 10 most dangerous habits for your prostate. The 10th habit on our list involves a fundamental mistake most men make regarding hydration. Many mature men deliberately reduce their water intake, especially in the evening, thinking this will decrease their bathroom visits during the night. However, this strategy backfires spectacularly and creates exactly the opposite effect they're trying to achieve. When you don't consume adequate water throughout the day, your urine becomes highly concentrated and acidic, which directly irritates both your bladder and prostate gland. Remember, your prostate sits directly below your bladder, so when your bladder suffers from irritation, your prostate experiences that same inflammation. Chronic dehydration triggers systemic inflammation throughout your body, and inflammation is one of the primary drivers of prostate enlargement. Additionally, many men in this age group take medications that can contribute to dehydration, compounding the problem significantly. A dehydrated body also accumulates toxins more readily, overwhelming your entire urinary system and creating a cascade of problems. Over time, this silent damage results in progressive prostate enlargement and increasingly severe urinary symptoms that interfere with sleep quality and daily activities. The solution is remarkably straightforward yet powerful. Drink water in small amounts consistently throughout the day, even when you don't feel thirsty. Your urine should appear clear or very pale yellow, indicating optimal hydration status. Don't fear water consumption. It's your natural ally in the fight against prostate problems. Proper hydration actually reduces inflammation, helps flush toxins, and maintains healthy tissue function throughout your urinary system. The 9th dangerous habit involves remaining sedentary for extended periods throughout the day. I understand that after age 60, the comfortable chair becomes increasingly appealing, but spending hours in the same position can damage your prostate in ways you never imagined. When you remain seated for prolonged periods, you create constant pressure on your pelvic region, which significantly reduces blood circulation to your prostate gland. This reduced circulation causes inflammation and directly contributes to prostate enlargement over time. Men who spend entire days watching television, reading, or working at desks face substantially higher risks of developing prostate problems compared to those who move regularly. It's not about avoiding rest entirely, but rather about preventing prolonged immobility that stagnates blood flow. Your pelvic floor muscles also weaken when they remain inactive for hours, making complete bladder emptying increasingly difficult. This incomplete emptying leaves residual urine in your bladder, which irritates your prostate further and creates an environment conducive to bacterial growth and infection. The accumulated pressure from sitting also compresses nerves and blood vessels that supply your prostate with essential nutrients and oxygen. The remedy is simple, but requires consistency. Stand up every 30 minutes and walk for at least 2 minutes. This movement can be as basic as walking to the kitchen for water or taking a brief stroll around your home. This simple practice maintains healthy circulation, relieves pressure on your prostate, and keeps your pelvic muscles active and strong. Don't allow a sedentary lifestyle to evolve into a serious health problem that could have been easily prevented. Our eighth dangerous habit concerns excessive caffeine consumption, particularly through coffee and energy drinks. I recognize that coffee culture is deeply ingrained in many societies, but excessive caffeine intake can irritate your prostate far more than most men realize. Caffeine acts as a natural diuretic, meaning it forces your body to produce more urine, which overburdens your bladder and creates additional pressure on your already sensitive prostate. Caffeine also causes the muscles surrounding your bladder to contract more frequently and forcefully, leading to urinary urgency and potentially embarrassing leakage episodes. For men who already have enlarged or sensitive prostates, this additional pressure exacerbates existing problems significantly. The effects don't stop there, however, as caffeine also constricts the muscles at your bladder neck, making complete emptying even more challenging. The result is a vicious cycle of increased urine production, incomplete bladder emptying, elevated pressure on your prostate, heightened inflammation, and progressively worsening symptoms. You don't need to eliminate coffee entirely from your daily routine, but moderation becomes crucial for prostate health. 1 cup in the morning typically won't cause significant problems, but multiple cups throughout the day can be genuinely harmful to your urinary system. Try substituting your afternoon coffee with herbal tea or decaffeinated alternatives, and monitor whether your urinary symptoms improve over the following weeks. Sometimes, these small adjustments create surprisingly dramatic improvements in comfort and function. Pay attention to your body's responses and adjust accordingly, as individual sensitivity to caffeine varies considerably among men. The 7th habit involves consuming excessively spicy and processed foods on a regular basis. While flavorful cuisine certainly enhances meal enjoyment, excessive consumption of highly spiced and processed foods can trigger silent inflammation throughout your body, including your prostate gland. Foods loaded with hot peppers, excessive black pepper, and fiery sauces increase systemic inflammation when consumed regularly. An occasional spicy meal won't cause lasting problems, but daily consumption can irritate an already sensitive prostate and worsen existing symptoms. Processed foods present even greater challenges for prostate health. Packaged snacks, processed meats, frozen meals, and fast food contain high levels of preservatives, artificial colors, excessive sodium, and unhealthy fats that disrupt your hormonal balance and promote inflammation. Excessive salt intake causes fluid retention and increases pressure throughout your entire urinary system. Unhealthy fats and chemical additives can affect testosterone levels, a hormone that directly influences prostate size and function. If your meals come primarily from packages rather than fresh ingredients, your prostate may be paying a significant price for this convenience. The solution involves prioritizing natural, anti-inflammatory foods, such as fresh vegetables, fruits, lean fish, and nuts. Healthy eating doesn't require sacrificing flavor or enjoyment. It simply demands better balance and more thoughtful food choices. Focus on whole foods that nourish your body rather than processed options that create inflammation and hormonal disruption. Our 6th dangerous habit is one that virtually every man has practiced at some point: holding urine when you feel the urge to urinate. Whether due to being busy, being away from facilities, or simply not wanting to interrupt activities, regularly suppressing the urge to urinate can cause serious damage to your prostate over time. When you hold urine for extended periods, your bladder stretches beyond its normal capacity and presses directly against your prostate. This prolonged pressure causes irritation and swelling in prostate tissue, and mature men are particularly vulnerable because the muscles controlling both bladder and prostate function naturally weaken with age. Holding urine also frequently leads to incomplete bladder emptying when you finally do urinate, leaving stagnant urine that creates an ideal environment for bacterial growth and inflammation. This accumulated urine can lead to urinary tract infections that further irritate your prostate and contribute to its enlargement. The pressure from an overly full bladder also affects nerve function and can create lasting changes in how your bladder and prostate communicate with each other, potentially leading to chronic dysfunction. To protect your prostate effectively, listen carefully to your body's signals and respond promptly. Don't postpone bathroom visits, especially if you already experience sleep disruption or nighttime urgency. Urinating as soon as you feel the urge represents one of your best defenses against prostate problems. Remember that your bladder and prostate function as a coordinated team, and when one suffers, the other inevitably feels the impact. The fifth dangerous habit involves smoking or regular exposure to secondhand smoke. Cigarette smoking ranks among the worst enemies of prostate health, and even if you don't smoke personally, regular exposure to others' smoke creates significant harm. The chemical compounds in tobacco smoke reduce blood flow throughout your body, increase inflammation, and damage delicate tissues, including those in your prostate gland. Smoking also dramatically increases oxidative stress, impairing your body's natural ability to repair damaged tissues and fight inflammation. Over time, this leads to chronic prostate inflammation, gland enlargement, and substantially increased risk of prostate cancer. For mature men, these harmful effects accumulate more rapidly because their body's natural repair mechanisms have already begun to slow down. Cigarette smoking also depletes essential antioxidants from your system, weakening your natural defenses against prostate problems and other health issues. Even if you quit smoking years ago, continued exposure to secondhand smoke can still negatively impact your health and slow your body's healing processes. If you currently smoke, speak with healthcare professionals about effective cessation strategies. Multiple proven therapies exist, including nicotine replacement options, counseling support, and natural treatments that can help you quit successfully. The benefits begin almost immediately after stopping, with circulation improvements and inflammation reduction starting within weeks of your last cigarette. If you've never smoked, avoid all exposure to tobacco smoke whenever possible. This simple decision can help ensure years of better prostate health and overall well-being. The correlation between smoking and prostate problems is well established, making tobacco avoidance one of the most important steps you can take for long-term prostate health. Our fourth dangerous habit involves avoiding regular medical consultations and screenings. Many men only seek medical attention when symptoms become truly bothersome, but this reactive approach can be genuinely dangerous, especially after age 60. Prostate enlargement often progresses silently without obvious symptoms in its early stages, making regular checkups essential for early detection and intervention. Routine medical visits help identify problems early, before they become serious or irreversible. Simple examinations can reveal signs of inflammation, infections, or abnormal growth that haven't yet caused pain or obvious symptoms. Tests such as digital rectal exams and PSA blood tests are quick, minimally invasive, and can literally save lives through early detection of serious conditions. Skipping these routine consultations means missing crucial opportunities for preventive action. Some men feel uncomfortable discussing urinary problems, but the earlier you address concerns, the more treatment options you'll have available. Many prostate issues can be managed effectively with lifestyle changes alone when caught early, avoiding the need for medications or surgical interventions. Postponing medical consultations can allow minor problems to progress into serious conditions such as urinary retention, severe infections, or advanced prostate disease. Schedule annual visits with qualified healthcare providers to discuss your prostate health specifically. This isn't just about peace of mind. It's a powerful prevention tool that can help you maintain optimal function and avoid serious complications. Don't wait until symptoms become unbearable before seeking help. Preventive care represents the smartest habit any mature man can adopt for long-term health and quality of life. Early detection and intervention almost always lead to better outcomes and less invasive treatments. The third dangerous habit on our countdown involves excessive consumption of red meat, particularly processed varieties. While red meat may be a dietary staple for many men, consuming it daily can silently contribute to prostate enlargement and inflammation. Research consistently shows that high consumption of red meat, especially processed options like bacon, sausages, and deli meats, correlates with increased body-wide inflammation, including prostate inflammation. Saturated fats and chemical preservatives used in meat processing are significant contributors to this inflammatory response. These compounds can disrupt hormonal balance and increase oxidative stress, both of which promote prostate inflammation in mature men. Additionally, digestion naturally slows with age, and red meat requires more energy and time to process completely, contributing to weight gain and increased pressure in the pelvic region. The digestive burden of frequent red meat consumption can also affect nutrient absorption and create metabolic stress that indirectly impacts prostate health. You don't need to become vegetarian overnight, but reducing red meat consumption to once or twice weekly can create substantial improvements in prostate health and overall well-being. Replace red meat with lean protein sources such as fish, grilled chicken, or plant-based proteins like legumes and beans. Experiment with meals rich in fiber and plant nutrients, such as lentil soups or dishes featuring various beans. These dietary changes support prostate health while improving digestion, reducing inflammation, and providing essential nutrients that promote healing and optimal function. Your body will respond to these changes with reduced symptoms, increased energy levels, and improved long-term prostate function. The key is making gradual, sustainable changes rather than dramatic overnight transformations that are difficult to maintain. Our second most dangerous habit involves carrying excess weight around your midsection. As we age, extra weight around the waistline isn't merely a cosmetic concern. It represents a serious warning sign for prostate problems. Abdominal fat produces inflammatory chemicals that circulate throughout your body, including your prostate gland, creating chronic low-grade inflammation. This constant inflammation irritates your prostate tissue, contributes to its enlargement, and increases your risk of urinary problems, sleep disruption, and even erectile dysfunction. Men with larger waist measurements have significantly higher rates of enlarged prostate, frequent nighttime urination, and related complications compared to those who maintain healthy weights. Excess weight also disrupts your hormonal balance, particularly the relationship between testosterone and estrogen, both of which directly influence prostate size and function. The solution doesn't require extreme dieting or exhausting exercise routines, but rather gradual, consistent improvements in eating habits and activity levels. Short daily walks, smaller portion sizes, and reduced sugar consumption can begin melting away that problematic abdominal fat. Losing even a few pounds can provide noticeable relief from urinary symptoms and improved overall comfort. Remember that abdominal fat also physically presses against your bladder and pelvic organs, worsening pressure on your prostate through direct mechanical compression. Maintaining a healthy waist measurement, typically below 40 inches, represents one of the most effective long-term strategies for prostate health. This single change can dramatically reduce your risk of prostate problems while improving your overall health, energy levels, and quality of life. The number one most dangerous habit, which most men completely ignore despite its critical importance, is failing to manage chronic stress effectively. This oversight represents the single most harmful behavior for your prostate health, yet it's the habit that receives the least attention from both patients and healthcare providers. Chronic stress acts as a silent inflammatory trigger throughout your body, including your prostate gland. When you live in a constant state of anxiety, tension, or worry, your body continuously releases stress hormones such as cortisol and adrenaline. Over time, these hormones create widespread inflammation, muscle tension, and hormonal imbalances that directly affect your prostate function and size. Chronic stress also constricts the muscles in your pelvic region, restricting blood flow and irritating the nerves surrounding your prostate. Stress hormones also suppress immune system function, making it harder for your body to fight inflammation or infections that might affect your prostate. Mature men often carry stress silently, dealing with financial concerns, family problems, health worries, and other life challenges without adequate coping strategies. This accumulated stress manifests as increased urination frequency, pelvic pain, urinary urgency, and progressive prostate enlargement. However, here's the encouraging news. You have the power to control and reduce your stress levels through simple, proven techniques. Daily deep breathing exercises, gentle physical activity, stretching routines, and even 10 minutes of quiet meditation can dramatically reduce your stress hormone levels and their harmful effects on your prostate. Laughter, meaningful social connections, and quality sleep serve as powerful natural remedies for both stress and prostate problems. Managing stress isn't just about feeling better emotionally. It's about healing your body from the inside out and creating an environment where your prostate can function optimally and even begin to heal naturally. This single change in stress management can help reduce existing symptoms and stop prostate enlargement progression without medications or invasive procedures. It represents the most powerful step you can take today for a healthier, more comfortable life and optimal prostate function. Now that you understand these 10 habits that silently damage your prostate, the critical question becomes, what will you do with this knowledge moving forward? These aren't just minor lifestyle adjustments. They represent powerful steps that can prevent months or even years of discomfort, sleepless nights, and unnecessary medical interventions. If you're over 60, the time to take action is right now, today. Don't wait for symptoms to worsen or become unbearable before making changes. Start by modifying just one habit this week, whether that's drinking more water throughout the day, taking short walking breaks every 30 minutes, or saying no to that extra processed meat at breakfast. Every single action counts toward better prostate health. Your prostate won't heal overnight, but with the right habits and consistent effort, your body possesses remarkable healing capabilities. Remember that you're not alone on this journey toward better health. With accurate information and commitment to change, it's never too late to start taking better care of yourself and your prostate health. The path to better prostate health starts with the choices you make today. Take control of your health, implement these changes gradually, and watch as your body responds with improved function, better sleep, and greater comfort. Your prostate will take care of you when you take proper care of it. If you found this information valuable and want to transform your health starting today, please hit that subscribe button and ring the notification bell so you never miss our latest health insights. Leave a comment below sharing which habit you're going to change first. And don't forget to give this video a thumbs up to help other men discover these life-changing strategies. Share this video with any man in your life who could benefit from better prostate health, because knowledge shared is health multiplied. Thank you for watching, and here's to your healthiest years ahead.